Clock reads 1:47 in the morning. You wake. You walk carefully to the bathroom. You return to bed and try to fall back asleep. At 3:18, it happens again. By morning, you have technically spent 8 hours in bed. It does not feel like 8 hours of sleep. It feels like fragments. Doctors call this nocturia. Getting up during your main sleep period to urinate, usually with sleep before and after the bathroom trip. But that word only describes what happened. It does not explain why. You have probably blamed your age, your bladder, your prostate, if you are a man. Maybe the glass of water after dinner. So you have been cutting back on evening fluids with little to show for it. Those explanations are reasonable and sometimes partly correct, but they do not explain every case. Here are two questions almost nobody asks themselves. Did the urge itself wake you from sleep? Or were you already awake, restless, uncomfortable, before you even noticed you needed the bathroom? And when you went, was it a large amount? Or did it feel urgent and barely anything came out? Those two answers can point a medical evaluation in very different directions. And for some adults over 60, the reason they are producing so much urine at night does not begin in the bladder at all. The ankle clue matters because fluid you notice at 6 in the evening can become the urine that wakes you at 2 in the morning. That connection is the first pattern we need to understand. By the end of this video, you will know 3 broad patterns behind nighttime urination and a simple way to track your own over 3 nights. So your next conversation with your doctor starts from real observations, not memory alone. Nighttime urination is a symptom, not a diagnosis. The bathroom trip is the event you notice. It is not necessarily where the story begins. 3 patterns. First, your body is producing or moving more urine into the nighttime hours than usual. The bladder is simply receiving more than it normally would. Second, the bladder itself struggles to store or empty properly. Third, something else wakes you first, and the bathroom visit happens because you are already awake. Some people experience more than one at once. Here's the first clue almost nobody pays attention to: the amount in each nighttime trip. A genuinely large amount points toward the first pattern. A small amount with strong urgency points toward the second or third. Remember 3 words: amount, sequence, daytime clues. We will return to them throughout, and the first pattern is where the most surprising part of this video lives. Think about your ankles for a moment, not your bladder. Sock marks pressed into your skin by evening, shoes feeling tighter after a long day, ankles fuller at dinner than at breakfast, especially after sitting for a while. During the day, gravity allows a small amount of fluid to settle around your lower legs. For some people, this is mild and unnoticeable. For others, especially after long sitting, it becomes visible. When you lie down at night, gravity stops pulling that fluid downward the same way. Over the following hours, some of it returns to your bloodstream. Your kidneys process it the way they process any fluid passing through. Several hours later, that processed fluid becomes urine. Your bladder fills. You wake. Legs during the day. Bloodstream after lying down. Kidneys during the night. Bladder hours later. This may explain a specific pattern, a larger than expected volume at night, waking more in the first half of the night. Ankles fuller before bed than they were that morning. And, often the most surprising part, no matching urgency or frequency during the daytime. This does not mean your bladder is weak. It may be doing its job perfectly. It is simply receiving fluid that arrived from a circulation process happening elsewhere in your body, hours before you ever felt the urge. One important caution. Swollen ankles do not automatically mean a serious heart condition. Prolonged sitting, vein changes, and certain medications can all contribute. But new swelling in only one leg, especially with pain, warmth, or redness, should be assessed promptly. If it appears alongside sudden breathlessness, chest pain, faintness, or coughing blood, that needs immediate medical attention, not a routine appointment. Amount, sequence, daytime clues. Were your ankles fuller before bed than in the morning? If your nighttime amounts were not particularly large, the explanation may lie somewhere else entirely, and it may not involve urine production at all. Think back to the last time you woke at night. Ask yourself something you have probably never consciously asked before. Did a clear, building pressure wake you directly from sleep? Or were you already awake? Tossing, uncomfortable, perhaps gasping or shifting position. And only afterward thought, since I'm awake, I may as well use the bathroom? By morning, Both get remembered the same way. I woke up to use the bathroom. The actual sequence may have been entirely different, and that difference matters more than it sounds like it should. Sleep itself can wake you first for several reasons: obstructive sleep apnea, insomnia, pain, restless legs, alcohol consumed earlier in the evening, an environment too warm, bright, or noisy to sustain deep, uninterrupted sleep. Sleep apnea deserves particular attention here because it can contribute in two different ways at once, and most people only know about one of them. The breathing interruptions themselves, repeated pauses, sometimes dozens of times a night, may wake you directly, fragmenting your sleep into short cycles that never quite reach deep rest. But the pressure changes associated with those breathing pauses can also trigger hormonal signals that encourage your kidneys to release more sodium and water overnight. That means sleep apnea does not sit neatly in just one category. It can fit both patterns simultaneously, waking you first and at the same time genuinely increasing how much urine your body produces while you sleep. The clues are not a diagnosis on their own, but they are worth raising directly with your doctor if several apply to you. Loud snoring. Someone in your household noticing pauses in your breathing during the night, waking abruptly with a gasping or choking sensation, morning headaches that ease as the day goes on, a dry mouth on waking, feeling unusually sleepy during the day despite having spent enough hours in bed the night before. Here is why this distinction matters in practice. If a treatment plan focuses entirely on the bladder, medication, fluid restriction, pelvic exercises, but the actual driver behind your awakenings is fragmented sleep, that plan is going to disappoint you. Not because it was the wrong idea, because it was aimed at the wrong starting point. So let's bring this together. 3 patterns. Too much urine reaching the bladder at night. A bladder that struggles to store or empty. Or sleep waking you first, with the bathroom visit simply following along behind it. Amount. Sequence. Daytime clues. If your amounts have been consistently large, the legs are not the only place excess fluid can come from. A more useful question is this: what could cause your kidneys to process or release more fluid than usual, or release it at a different time? When blood glucose runs significantly elevated, glucose can spill into the urine, and through a simple osmotic effect, pulls additional water along with it into the bladder. More glucose present in the urine means more water drawn in alongside it, which means more total volume your kidneys are sending downstream. The accompanying clues tend to include increased thirst, more frequent urination during the day as well as the night, and a noticeable shift away from what has been your normal pattern for some time. That last part matters because a recent change is more informative than a pattern that has been stable for years. This is worth mentioning to your doctor directly, particularly if it feels new. The second contributor is simply what happens in your evening hours, a large volume of fluid close to bedtime. Caffeine consumed later in the day can disturb sleep and may worsen urinary urgency or frequency in some people. Alcohol, which increases urine production and fragments sleep architecture at the same time, making it a double contributor to a difficult night. A salt-heavy evening meal, which can increase thirst and alter your body's fluid balance, particularly if you are someone who is sensitive to sodium. None of this means you should restrict fluids throughout the day. That creates its own problems, especially for older adults who are already at higher risk of dehydration. It simply means the timing and composition of what you drink and eat in the evening is worth paying attention to. The third contributor is medication, specifically diuretics, sometimes called water pills, which are prescribed deliberately to help your body release excess sodium and fluid, often for blood pressure or heart-related reasons. Their timing during the day can directly influence when that effect is actually felt. I want to be completely clear about this. I am not suggesting you adjust, delay, or stop a prescribed diuretic on your own. These medications are frequently essential, and changing them without guidance can be genuinely risky. The right step is asking your prescribing doctor whether the timing, not the medication itself, might be contributing to your nighttime pattern. The broader lesson is not that any single evening habit explains every case on its own. It is that consistently large nighttime volumes point your attention toward the kidneys, your circulation, your blood sugar, your evening intake, and your medication schedule, not only toward the bladder as the default suspect. If your nighttime trips instead involve smaller amounts, urgency, or any difficulty with the stream itself, the investigation moves in a different direction entirely. Everything so far has pointed away from the bladder and prostate as the automatic explanation. I want to be equally honest that sometimes they genuinely are the center of the story. And this matters whether your nighttime amounts are large or small. Sudden, strong urgency, small, frequent trips, difficulty postponing the urge even briefly, occasional leakage on the way to the bathroom, similar urgency by day as by night, or burning or discomfort. This points toward lower urinary tract irritation and should raise the possibility of infection or another bladder-related condition. A bladder that cannot comfortably store urine will signal the need to go well before it is genuinely full, which is part of why the urgency can feel so much more intense than the actual volume justifies. Hesitation before urination begins, a weak or interrupted stream, straining to start or finish, dribbling afterward, a sense of not fully emptying, or needing to return to the bathroom again shortly after. This points toward emptying difficulty rather than storage. In men, an enlarged prostate is a common contributor. Gradually narrowing the channel urine has to pass through. I do want to mention something important here, because it surprises many people. Prostate size and symptom severity do not always correspond as neatly as people assume. A significantly enlarged prostate can sometimes cause only mild symptoms, while a moderately enlarged one can sometimes cause considerably more disruption. Size on its own does not tell the whole story. I want this video to speak just as clearly to women, because storage and emptying difficulties are not male-specific conditions. Overactive bladder, changes related to the pelvic floor, pelvic organ prolapse, and urinary changes connected to menopause are all genuine, well-recognized contributors. And they deserve the same direct conversation with a doctor that prostate symptoms would receive in men. So the useful question is never simply, is this my bladder or not? It is more precise than that. Am I producing too much urine? Am I storing or emptying it poorly? Or am I waking for a completely different reason, with the bladder simply being the thing I notice once I am already awake? Amount. Sequence. Daytime clues. You do not need to diagnose yourself tonight. You need to start noticing the pattern clearly enough to describe it. For 3 nights, begin with 6 observations. This is not a diagnostic test. It is a pattern log, something to bring into the conversation rather than a replacement for one. 1. Bedtime and what you drank that evening. 2. The time of every awakening. 3. Whether the urge woke you or you were awake first. 4. Whether the amount felt small, medium, or large. 5. Any difficulty starting, weak stream, or strong urgency. 6. Daytime clues. Ankle swelling, unusual thirst, frequent daytime urination, snoring, or heavier fatigue than usual. That is genuinely all I am asking you to remember tonight. Additional details. Type of evening drink, caffeine or alcohol specifically, a salty meal, diuretic timing, or measured urine volume. I will leave as optional extras on screen. Your doctor may also want you to complete a full 24-hour bladder diary with measured volumes, because that gives a more precise picture than a subjective log alone. Tonight's 6 observations are simply the starting point. Bring this record and ask your doctor 5 things. Does my pattern suggest too much urine at night or reduced storage? Could disrupted sleep be waking me first? Could fluid shifting from my legs be contributing? Should my blood sugar, kidney function, or medications be reviewed? And am I fully emptying my bladder, or could something be left behind each time? A short list deserves prompt attention rather than a routine appointment. Blood in the urine, fever with painful urination, sudden inability to urinate, severe lower abdominal pain, new shortness of breath with significant swelling, extreme thirst with unusually large urine volumes, repeated falls or near falls on the way to the bathroom. None of these should wait. This channel exists to keep explaining the health changes after 60 that get dismissed as simply aging when there is often more underneath. Think back to that clock. 1:47, 3:18. Next time you wake, notice 3 things instead of 1. Was the amount large or small? Did the urge wake you, or were you awake first? And what happened earlier that day? Your ankles, your thirst, your stream, the sound of your own breathing? Your bladder may be the source. It may also simply be the messenger, receiving the consequences of something happening in your legs, your bloodstream, your kidneys, or your sleep. Nighttime urination becomes more common with age. That much is true. It does not mean every pattern should be accepted as something nothing can be done about. Not every case resolves completely. But understanding the mechanism makes treatment far more specific, and your next appointment far more useful than it would otherwise have been. When you stop treating every nighttime bathroom trip as the same problem, you give yourself, and your doctor, a much better chance of finding what is actually disturbing your sleep.